listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, you've heard us mention ready to sell on the podcast before. It's required to be ready to sell with carriers before the annual enrollment period if you want to sell Medicare products for the upcoming plan year. We define what that means and outline the steps to get there in What Does Ready to Sell Mean for Medicare Agents? Written by Roxanne Anderson. To achieve Medicare Ready to Sell status, RTS for short, agents must meet a few annual requirements. Let's walk through what those requirements are. The first one may be a little obvious, but in order to be ready to sell, you have to contract with carriers to sell their Medicare Advantage, Part D, and Medicare Supplement products. If you don't, you won't have any Medicare products to offer your clients. Once you're contracted with a few carriers, that doesn't necessarily mean you're all set to sell their plans. You still have other ready-to-sell requirements to meet. While you may be able to contract with a carrier once and not have to recontract with them to sell in future years, you must complete certain certification trainings every year, especially if you wish to sell Medicare Advantage and Medicare Part D plans. Most carriers don't require Medicare Supplement agents to complete certifications. These Medicare agent certification requirements include Medicare and Fraud, Waste, and Abuse, or FWA, training, as well as product trainings. Looking closer at Medicare and FWA training while we're on the subject, acceptable Medicare and FWA training is usually offered by third parties like America's Health Insurance Plans, AHIP for short, Pinpoint, Sentinel Elite, and the National Association of Benefits and Insurance Professionals, or NABIP, which was formerly the National Association of Health Underwriters, or NAHU for short. The most widely accepted Medicare and FWA training among carriers tends to be AHIP's certification training, but acceptance of NABIP's Medicare certification program is growing. You can check out the notes to learn more about AHIP and NABIP certification. In addition to Medicare and FWA training, many Medicare Advantage and Part D carriers also require that agents complete their own specific product trainings each year. These trainings vary from carrier to carrier and year to year because each carrier focuses on their specific plans and offerings. For example, new plans, service areas, expansions, and new features, to name a few. Make getting ready to sell Medicare products easy. Now that you know what being ready to sell Medicare plans means, it's time to start work toward achieving that status. Here at Ritter Insurance Marketing, we aim to make this process as easy and straightforward as possible for new and returning Medicare agents with our free tools, like this podcast. But our show is really just the tip of the iceberg. You can create a free profile on our site to gain access to our free online contracting tool and certification center, which includes details, dates, requirements, and links for major Medicare Advantage and Part D carrier certification trainings. Our full-time licensing and administrative support departments will follow up to help you complete the necessary tasks and advocate on your behalf to the carriers you contract with. The link to start your Ritter registration can be found in the episode notes. Already contracted with carriers through Ritter? If so, that's great. You can easily check if you're ready to sell with each of your carriers in the Ritter platform. Simply log into the platform and confirm you're ready to go. And if you're not sure where to go, it's as easy as following the instructions on the Ritter Docs site to help you along the way. As you're checking your RTS statuses, please remember, even if your contract status says appointed, you may not be considered ready to sell. You must check that you have completed your carrier certification requirements for the current and/or upcoming plan year as well, depending on which plan years you'd like to sell for. Another important note, carriers may send you a ready-to-sell confirmation notice once you've completed all their RTS requirements. If you do not receive these confirmations, you may want to contact your carriers to confirm you're all set. We have had agents assume they are good to go with carriers, only to find out at the start of AEP they still had certain requirements to meet before being able to sell. It never hurts to double check. And that's how to get ready to sell. It's a pretty simple process once you know what to do. While it may be tempting to view it as another hoop you have to jump through to sell Medicare plans each year, think of it more as a way to make sure you have all your ducks in a row before the busy season starts. You don't want AEP to arrive and not be ready to maximize your earned commissions. The ready-to-sell process just helps you ensure that you are set to go. We hope you enjoyed this episode. Thank you so much for listening. Don't forget to peruse the episode notes for more of Ritter's tools and resources. If you have any questions, you can email us at asgpodcast@ritterim.com. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an Integrity company. This episode was written by Roxanne Anderson. Script adaptation by Tina Lamoureux. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with our show wherever you like to listen.